Welcome back to the Art of Divergence, brought to you by Neurodivergent Ohio. I am Sammi Behr, LISW.
I am Heather Seitz, LPCC-S.
And I'm Allie Dennis, LST, under the supervision of Sherri Behr, LISWS.
Also, just a little note from the last episode. Because I'm a neurodivergent human being, I got our name wrong in the first few seconds of the episode. So, to correct from last episode, our name is the Art of Divergence, not the Art of Neurodivergence. And it is okay to make mistakes. So, I just wanted to make that clear.
The information provided on this website and the NDO, the Art of Divergence podcast, is intended for informational and entertainment purposes. It does not act as a substitute for the diagnosis and treatment of mental health concerns.
And the next thing we want to do is do a little mental health check-in of where we're all coming from today. I think last time we were feeling a little excited, a little nervous, and very ready, and we got a little ahead of ourselves with the speed that we were going at. And I think as a first podcast, you ramble a little bit, you have to find your flow. So I think we're a little ready to speak a little slower and calmer, and we got a lot of good info today, so I'm excited and enthusiastic. Heather, what about you?
Yeah, so I guess I'm definitely feeling like it's a Thursday, but I'm happy, I'm excited. I've got some great plans this weekend, and yeah.
And Allie, what about you?
I'm feeling nervous. This is a little bit more info than I'm used to, but I'm excited to be here. So thanks for letting me join.
Cool. Well, we will try and keep it as accessible and understandable as possible. And if we need something explained differently, one of us can always pipe up and say, maybe that doesn't make a lot of sense. We can put it a different way. But getting into what our actual topic is today, we are, as a follow-up to our last episode, going to talk about the most prominent areas of neurodivergence and their causes. So last episode, we talked about what neurodivergence is, highlighted ADHD, autism, dyslexia, some other common things that fall under that big umbrella we talked about. Now we're going to talk about the causes, the genetics, hereditary, acquired, all of that stuff, some common perceptions of causes and diagnoses, and also we're going to dispel some misinformation because we know that's really rampant in this topic. So we're going to give a clinical, scientific overview with a little personal experience where we can. And Allie is going to start us off talking about ADHD.
ADHD, did you know, actually was not diagnosed until like mid 90s. There was a lot of stuff going around ADD and maybe hyperactivity, but ADHD was not a diagnosis. And I found that to be really interesting because that's around the time I was born. And I remember being in grade school and they would diagnose maybe boys more with hyperactivity, but girls wouldn't get a diagnosis. So yeah, that's a little interesting feedback about ADHD and the history around it. With the genetic component, though, it's not necessarily all about what you're exposed to, but also if your parent has ADHD.
So yeah, a lot of the factors in the cause of ADHD are genetic, and with genetics, it's generally what we would call hereditary, coming from parents. And the leading science on this tells us that about 80% of ADHD is genetic, with 35% of that, these are going to be they don't all add up to 100, but we'll get a little more into that later. But 35% of ADHD being what we would call acquired or developed outside of specifically inheritance, and 65% being specifically inherited from a parent or, along your genetic line. So we see most of the time, even if it's undiagnosed, because not everybody gets assessed, obviously, parents of ADHD kids with some traits, with some diagnosability there. Not always, but a lot.
Yeah, and interestingly enough, Sammi, I think kind of what you were going off with that is there's not necessarily one specific thing that can be a contributor to ADHD. Sometimes it's a combination of things. Sometimes it can be some environmental things, sometimes it can be developmental, sometimes it can be genetic. So just because there is one thing that hey, that's running in the family doesn't necessarily mean there's other things that aren't going on that could have also contributed that and increased the risk of ADHD. And then Allie, I know that you had said something about like the difference between boys and girls. And we do tend to see that very differently. It's becoming a little more noticed, but men tend to externalize a lot more than women who tend to internalize. So sometimes there's that misdiagnosis or they don't get diagnosis, just like you were saying.
And I think that there's a complex history as well, because politics plays into if you have access to a diagnosis, as well as do you know if you have a diagnosis based off your family history. So there's a lot of factors, as you all mentioned, to actually having ADHD. Some of the environmental factors based off of research that I've reviewed are, to be taken with a grain of salt because they're still being researched. So those environmental factors could be mom was exposed to lead, or sometimes people say smoking or trauma. At the same time, there's other research out there that has disproven this. So we have to kind of take that research as not necessarily the end all be all, because we have more science coming in to tell us differently, and it's not a causal factor. And I know, Sammy, you had a little bit about that as well.
Yeah. So with these studies, like since the 80s, since the 90s, where we saw the first kind of developments of heavy research into neurodivergence, there's a lot of enthusiasm. So any links that researchers can find, we kind of clamor onto those and want to use them as defining factors. And a lot of the time, we're seeing studies with confounding factors or correlation, not causation. And so, like you said about trauma, on the note of trauma and its associations with ADHD, there are some narratives out there from social media, unfortunately, that childhood trauma can cause ADHD to develop rapidly in children, or that poor parenting habits or behaviors can cause the development of ADHD traits. So there are also misconceptions about diet, about video game use, about TV, about, iPads, all of that. None of these associations are actually supported by the hard science that we have, but rather the trauma, things like developmentally harmful parenting practices, lack of developmentally appropriate stimulation, leaving a kid in front of the TV for hours, those can exacerbate the symptoms, but they don't cause them.
Right.
The brain work is already there. The symptoms are basically, they kind of become behaviors. And what we know about the brain and how it functions behaviorally is that neural pathways form and kind of cement us into that muscle memory of behavior. And when we are at peak developmental stages in that early childhood span of life, what looks like a development of a certain condition in the brain is usually an exacerbation of what's already there, or exacerbating meaning making it worse. Those symptoms that we then use as diagnoses. And a lot of parents are like, well, they weren't like this before. We didn't see these behaviors until this point where, some of this stuff we had already observed happening. It doesn't mean that it is the cause scientifically. And while I think some people might think that's a little bit of a semantic thing, it's important because when we know the specific cause, we know how to treat it properly. So ADHD is treated with a combination of behavioral change and medical intervention. So I think it's really important to know that it's not all just one or the other. It's not all genetics. It's not all early life conditions. It can be both. And a lot of cases are just different levels of both of those things. And also, when we reference trauma specifically, we mostly refer to the factors that can contribute to delay or damage of fetal brain development. And that's what's going to contribute to what I said before, that acquired part. So is this all making sense? Are we all are we all on the same page with
I'm
all of
with
that?
you.
Cool. But the other part that I have kind of found through my research and through looking into this for our conversation is that Dr. Russell Barkley, who I'm sure I will bring up a million more times, probably the leading, but a leading ADHD researcher, presented the theory of acquired versus inherited ADHD. And after some extensive review of research on the topic, which included genetics, genetic testing, neurological imaging scans, all of that good stuff, he concluded that 30% of ADHD is acquired, while 65% is inherited. So included in that acquired, which is not meaning that I guess to explain more, included is those prenatal development issues that can damage fetal brain development. So that does include, like poverty in pregnancy, to where a mother's not getting the resources they need, or alcohol use or drug use during pregnancy, or extreme trauma and stress to a pregnant mother's body and mind has an effect on fetal development. Lead. Smoking is an interesting one that I'll get into a little more later, or next, I guess. But yeah, so it's kind of a fine line of, we have what genetics already has programmed into this fetus's development, and then how the developmental pre-birth environment affects that development. So we got what's written and what's kind of like the nature and the nurture, if you could say. These conditions, including trauma, are what can shape that in a more acquired versus like genetically programmed type of way. So even though it's before birth, it still counts in this category of acquired. But the other causes of acquired ADHD can be associated with TBI, traumatic brain injury. And trauma can cause these conditions that damage the frontal lobe, which is, the damage that TBI causes. But with the severity these traumas have to reach, like, severe damage to the body, severe injury or accident, in some cases, traumatic events in life that do change your brain chemistry, like, psychosis can damage the brain, shock can damage the brain, things like that. But the severity these have to reach is so high that we are not talking about a lot of cases. We're talking about a pretty small minority of acquired cases that develop from traumatic conditions within life. All of that to say that the narrative about trauma causing ADHD in the teeny tiniest bit is true, but science says that it's the smallest minority of the causes that we know of what ADHD is in the brain.
Something that I think is important to note here is, if you're a parent and you're listening to this and you're starting to panic because you're starting to resonate with some of these things and questioning, is there something that I did to contribute? The important thing is to remember that you were doing the best that you can with the resources available to you. So I think it's important to remember that. And it's not something to say that one thing caused the other. It's the lack of resources that you did or did not have access to.
Yeah, I think it's really easy to self-blame, but at the same time, resources are only available if we have them in our communities. That is based off of who we currently have in charge of the country or the state.
So true, so true.
So blaming yourself, try not to go there too much, and just know there's support out there for you and your child. There's also late diagnoses that also deal with self-blame a lot. Like, why didn't I realize this earlier? Why didn't I get help earlier? It is the same reason, right? Like, you probably didn't have the resources or the knowledge at the time, which is not always just your fault. It's based off of what our communities support.
Absolutely. I am so glad that you brought that into the conversation, because especially when we talk about acquired ADHD and things that can exacerbate symptoms, sometimes we do see cases where, I guess sometimes people classify them as adult onset ADHD, which onset, take that word lightly medically, but we see a bunch of factors coming into light within your certain life situation. So sometimes it's not even, the resources that you might have had at the time, but maybe the setting that you were in that didn't trigger those brain patterns to come out as much, like we said with women, and internalization of factors. Sometimes it is, those resources that you have and the stigma or societal attitude around the factors that are associated with ADHD. Like with women, we see a lot of covert ADHD that gets diagnosed as anxiety and depression.
Mhm.
And with that, it's kind of depending on how informed the people around young women are to know what the factors actually look like, and to investigate and ask the right questions that will lead us to, is it ADHD or is it other things, which is important because certain treatments are effective for certain things. We can't all mix it together and give it like too general, toxic positivity response and expect it all to work out in the end. The interventions we have for ADHD as an ADHD counselor are specific to the way the ADHD brain works. And maybe into that just a little more foundationally, ADHD is when your brain has a lower amount or a lack of efficiency with the way it uses neurotransmitters, specifically dopamine and norepinephrine. Those chemicals, those brain chemicals are basically what make our brain function. So what fuels our memory, what fuels our problem solving, what fuels our, visual and auditory intake. The way our brain functions is important to understand in the way that we treat certain brain conditions. Like if we give ADHD responses and interventions to depression and anxiety, that's not going to work out for someone. Those tools are not going to be what hits those brain issues in the right angle that we want to target them. Another thing I wanted to bring up is going back to that smoking factor and the difficulties with how science has misstepped, I guess you could say, or just not gotten to where it needs to be in the past and has developed some better conclusions, going forward into the future. In cases where we associate things like smoking while pregnant to having an ADHD child, which a lot of studies have been done on, there is this aspect of correlation versus causation, and bringing it back to the genetic hereditary factor of ADHD. People with ADHD are actually more likely to smoke cigarettes. We are more prone to addictive behaviors. We're more prone to substance use, unfortunately. That is enough of a correlation to where some researchers have basically hypothesized that association is specifically due to the hereditary part, mothers having ADHD and thereby being more likely to smoke, and that hereditary factor being the cause of the children's ADHD, not the damage from nicotine use on fetal brain development. It can be both. There is a little bit of, like I said, confounding factors. And just like how we were talking about how certain factors that affect mothers and the fetal development environment affect brain development, it's kind of could be two sides of a coin type of thing, where if you're smoking, it could be the nicotine effects on fetal development. It could be that maybe you have ADHD, diagnosed or undiagnosed, and you're passing that on hereditarily. So I think there's also something Allie had to know about, like other medication use and like medical decisions and whatnot that do affect the fetal brain development and have associations with ADHD as well, right?
Yeah, so you bring up a good point around it's kind of the case of we don't necessarily know what causes ADHD because there's so many factors. But say a mom is carrying a baby and has a fever or has an autoimmune disorder or inflammation, and they're prescribed Tylenol or Advil, which is pretty normal. They begin to take it. There's a lot of now research saying it's inconclusive whether it's the Tylenol or it's the inflammation that happened while they were pregnant. And so I think we need to take that into consideration before stopping all medications, like consult your doctor before you decide to just stop, because we don't know yet. And I think that's because it's so complex, right? Like it goes back to, does trauma cause ADHD, or does a parent having ADHD cause maybe more sensitivity to trauma? So it's important to loop in your medical provider before you stop or start medications.
It's important that, all of this stuff begins and ends with the professionals that can provide those assessments so that you're not coming up with conclusions as a person that might lack that clinical knowledge and might be trying to find it from, I would say, disorganized sources most of the time when it comes to social media, when it comes to social environments, political environments. A lot of that is disorganized in a way that's not conducive to you understanding the whole picture. And while you can get valuable, valid information, the organization of it and the application of it is really important for an actual professional to do. You're, as a parent, you're the expert on your child, obviously, but highly, highly encourage that you understand that expertise of these types of neurodivergence and brain development are, something that a doctor can help you with and something that you don't have to take on the mental load of yourself. Just because you are the end all be all protector of your child does not mean that you don't deserve to get some help. And, it doesn't mean that there is valid room for other professionals, years and years of education and expertise development. So I would advocate for there to be less shame and less desire to have to absolutely know it all when it comes to your child's brain development. Sometimes you can let the professionals, do their work and work alongside them for your child's success, a successful pregnancy, successful learning and development in childhood, and even like in supporting your adult children. There's aspects of associating professionals there too. So I think that's a really important part of it. And I think, when we get into the whole like use of Tylenol, fevers and sicknesses during pregnancy thing, that'll be a part of our next section here that we talk about autism, which I think Heather is taken over. Did we miss anything that we wanted to talk about when it comes to ADHD so far, guys?
The only thing I would like to chime in there at the end is social media is good to an extent for validation and seeing that other people are going through similar things. However, everybody is different and unique. And, just because that's experience of one person and some of it resonates with you, their experience is probably so much different than what yours is going to be and what mine is going to be. And so that's when it's good to be like, hey, like I'm seeing some similarities. Let's go to the professionals, right? Instead of just, Googling symptoms and diagnosing yourself with, 15 different things, consulting with your doctor and letting the medical professionals listen to those symptoms and then talk with you about what the next appropriate steps are. So, in talking about autism, one of the biggest things is the genetics, similar with ADHD. And there are many genes that actually can contribute to ASD. Some of it can be part of a genetic condition, which there's something called Rett syndrome, which is basically a slowing of a head growth, more so in girls. Then there's also things like Fragile X syndrome, which is also an inherited condition and can contribute to intellectual disability. The other big thing to know with autism is it can be caused by those genetic changes or gene mutations.
I think a helpful part of this to understand, again, going back to just like how the brain works and brain development, we're talking about genes, which are things that they, it's it's important to understand how genes work when it comes to like brain development. Genes are something like from birth that you have. Generally, they don't get activated by, suddenly at some point in your life. They can cause certain issues with certain health conditions in points of your life. But when we're talking about the basic foundations of brain development with these genetic changes in the autistic brain, we're not talking about things that get caused by, once again, certain behaviors, certain traumas, certain things like that. We will kind of go back a little bit to the acquired situation and TBI and all of that. But, with what Heather has described, it's important to center in on the fact that genetic changes are not things that are caused outside of the fetal development environment. Even still, like the development of the fetus in general, the fact that there is a fetus at all, it's already in there. The mutations are occurring at the, right after conception stages of these developmental processes. So, we are not even we barely got fingers and toes yet as this stuff is happening in the womb. So I think that's just good to know and good to have a frame of mind with when we're talking about causes of autism as it relates to some of the social rhetoric we have. And, coming at it from that frame of mind helps us interpret some of the maybe not as scientific things that we hear with more of a scientific lens. So I think that was just, a little good thing to take with us as we learn more about this.
Yeah, absolutely. And I know that according to the Mayo Clinic, boys are nearly 4 times more likely than girls to have autism. Although it does kind of go back to that notion similar with ADHD, where it's either misdiagnosed in women or they're not getting diagnosed. So even though there's a higher probability for boys, there is that consideration to take into play for girls. Some of the other things that also contribute to this are babies who are born prematurely, roughly at about 26 weeks or earlier. They will also have an increased risk of autism. And then obviously there's the high correlation with genetics. So the likelihood of autism increases if a sibling or a parent also has autism.
And there's also this association of fetal alcohol exposure with a higher risk of autism. So, just like we talked about with ADHD, things that damage the fetal brain development will sometimes be in correlation with a higher risk of developing any neurodivergence, as we'll also see with dyslexia, which I'm going to talk about in a little bit. But Heather, I think you got a point on more about the genetics of it too.
Yes.
No,
Yeah. So if you have a parent or a sibling who is also autistic, the increase of you having autism increases as well.
yeah,
And
that's similar to ADHD. Like we see in studies where a lot of the time, just like parents and children usually share ADHD,
Mhm.
usually there are associations with multiple sibling groups in, bigger families having ADHD if one does have it as well.
Yeah, and so something that's important to note in getting an assessment, checking in to see if autism is something that you or someone you know is dealing with, is getting a diagnosis early allows time for interventions, things like applied behavioral analysis, or you might hear it referred to as ABA. Doing that and beginning to work with the child on that can be very helpful. However, we do, I guess I should say, I sometimes see that if it is too early, and we'll see a lot of parents who want to see them at like 2 years old, try to get in for an autism assessment. And there's an urgency, right? You understand something doesn't feel right. You want to make sure they're going to succeed in the future. But sometimes it can just be simple, like developmental appropriateness. And when you get to that 3 age is where you might start to see more of it coming out and determine, okay, this is something that was a stage and they've moved through it or they're working through it. Or this is something that we really need to get a professional to diagnose and kind of see what's going on here. Early assessment and intervention can provide a child resources and give them early learning skills during the most vulnerable and optimal learning stage of their life. Always say there's that short window where you can learn a language and those kind of things. Same thing is for resources and coping skills and trying to train their brain how to respond appropriately to different situations.
I think it's also a good, callback to the ADHD stuff that we were talking about in that early brain development and the early neural pathways that form in regards to the early childhood brain pathway formation. When we target early and often in any sort of neurodivergence, we build resilience to a lot of the symptoms that we see being a struggle for people with these types of brains. And while the brain processes that make those symptoms come out is still there, the resilience factor of, someone who started ABA or ADHD intervention or specific dyslexic intervention at a very early age versus someone who had those struggles all their life, developed kind of a familiarity with them, and kind of grew into acceptance. This is just how my brain works. I just struggle with these things. And then tries to implement systems and interventions later in life may have more of a struggle developing that resilience. And so it's not necessarily that we are like curing these conditions, but early in life intervention helps to build the brain's resilience of the biggest parts of struggle and also the self-regulation aspect.
Mhm.
Neurodivergence always presents difficulties with self-regulation and regulation of our nervous system. And when we normalize and treat the conditions and symptoms of neurodivergence early and often in life, we have less of this aspect of self-judgment, of dysregulation, of fear and anxiety of these symptoms or, these symptoms as triggers of other mental health issues. So that's why that is so important. But I also want to say that again, there are lots of things in the stages of life that exacerbate or bring about the clear presentation of these symptoms. So it's not a point of requirement to say everybody that has neurodivergence can and should always be treated early and often, at the earliest point in life. It's a struggle of resources. It's a struggle of knowledge. We don't always have access to the professionals that can provide those interventions. So when I say that, I want to make it clear that I'm talking about best practice for these things, making sure that we don't put pressure on ourselves as parents and, community members, teachers, clinicians, that's not always possible in everybody's path. But this is, best practice. So it's good to remember that in that frame of things too, that you should not feel guilt if this is not something that's readily available to you or for your child. And now that we know a little more about the causes of autism, it's important to also discuss what they are not. Research does not support any causal link between vaccinations, the use of Tylenol by a birth mother or individual as a young child or infant, with the associations of ADHD, autism, or any other type of neurodivergence. We're seeing a lot of confusion when it comes to causation versus correlation. In studies that do touch on these topics, but some are unfortunately based on unreliable, unverifiable data and poor study quality, based on the hypothesis that the correlation is the causation. And when those are widely released, when those are put out, on a high, widespread level without the general clinical understanding of how to interpret these things, we get this sense of, we understand the cause as something correlated, and that becomes a general belief. And, we have to really, bring in the community of neurodivergent people and their loved ones, their parents, their friends, in understanding how to view this science, how to come at it from an educated, informed point of view. And there are definitely efforts to study the potential of these links. I will not say that there's absolutely nothing there whatsoever, because there are researchers diligently trying to prove or disprove these links, obviously. But we want to be clear in communicating that these links are theory and hypothesis only as of right now, and do not establish a widely accepted fact that these things that we've stated, vaccines, Tylenol use, environmental factors, are causes that we have already established, or that, we should be accepting as a medical community. As professionals, I think we all try and keep up on what's best practice and what's research based and evidence proven. And we have a direct familiarity with these poor scientific studies and the strong ones that we're actively talking about. So we wanted to make a little note of establishing that as, as hard scientific, reliable information for people that have it on their minds. It's, in the political and societal sphere right now, and it's important for people to have that correct, direct, specific information. And with that all summed up, I want to get into dyslexia and talk a little more about the causes of that, because I I researched it a lot for this episode and was not super familiar with all of the information that I'm going to present now. So I'm glad I got a chance to learn more about it, and I feel I have a better frame now to, help individuals as a clinician in my life, all of that. So basics of dyslexia is it can be a reading or listening dysfunction. It was first diagnosed in the late 19th century. Research on it, the really effective, successful research did start in, like we said, the 80s, 90s. And while it's described as a learning disability, it's more accurate to describe it as a neurological condition. And what a paper published in the Journal of Child and Adolescent Mental Health calls a core phonological deficit. So, phonological refers to the smallest parts of speech, which are called phonemes. This will get a little technical, so stay with me. Phonemes, the smallest parts of speech, are sounds like ba, da, small words like cat, or when you break down cat, it's like k, a, t are the phonemes, basically. And when you have a dyslexic brain, you struggle to separate phonemes within speech. So they all kind of get blended together, making it difficult to connect the speech sounds with the specific letters. So you understand words, you understand letters. When they all come together, sometimes the comprehension part gets messed up because your brain is interpreting those things in a disorganized way. Now, as with the other things we discussed, genetic, hereditary, usually you share it with a family member or parent. It's much like the pattern that we see in most neurodivergence. We look at these ways that the brain develops and they share these traits of being genetic, being hereditary. That's pretty much a solid foundation that we can understand all of these types of conditions from. So, in the Journal of Neuroscience, there was a link between the mutation of specific gene, the ROBO1 gene, that can lead to auditory pathways that connect the two sides of the brain to be weakened. And when we're talking two sides of the brain, like there's a lot of different parts that help us intake information. But what this study and another study in the Journal of Biology Psychiatry found through MRI scans is that in comparison to non dyslexic individuals, dyslexics have weaker connections between those brain parts, their visual centers, their prefrontal region, and their visual word areas. And this can explain why reading can be difficult and even speaking can be difficult, and why comprehension is usually not so much of an issue. We see dyslexic kids, dyslexic individuals comprehending things just fine. It's not the concepts that they struggle with, it's the translation from page to brain to speech, all in conjunction with each other. Another interesting thing to note that I found out is that ADHD and dyslexia have a 20 to 40% comorbidity rate, which means they occur together. Just they're diagnosed together most of the time. For autism and dyslexia, it was a little bit lower. It was 10 to 30. But and as we talked about with ADHD, and we didn't touch too much on it with autism, but there's still evidence to the same effect. There is a concept of acquired dyslexia or alexia that can result from traumatic brain injury. So if a traumatic brain injury changes the structure of your brain or the effectiveness or amount of your neurotransmitter availability, it can result in these same types of dysfunctions. And if your traumatic brain injury affects the connections between these parts of the brain that we talked about, like visual center, prefrontal, all that good stuff, there's a very real chance that you can develop alexia or acquired dyslexia. There's a great YouTube video I watched on the concepts and the causes and certain associations from, I think it's the Discovery Network, and I will link that in the comments. We're also going to link some of the studies and links to different articles or videos that note some studies along with, that are consistent with this information and that we use to inform some of our discussion here. So find that in the descriptions of our podcast. And now I think our next section is going to be Allie telling us a little bit about another myth that we would like to bust or debunk today. Go ahead with that, Allie.
So ABA was already mentioned earlier on applied behavioral analysis. It is very helpful for behaviors. A lot of people think that's the only intervention out there in the community for people who have autism or ADHD. There's actually some people out there that are calling for more inclusion at policies in school, so like including CBT, so cognitive behavioral therapy, DBT, and ACT interventions to help with depression and anxiety that can be comorbid with both autism and ADHD. So there's a lot more out there than just ABA. And I think it's helpful for parents to know that. And also positive parenting classes are also very helpful to kind of cope with maybe some of the behaviors they're seeing. And those are usually readily available in schools.
I think it's important to note that call for a little more neuroaffirming model to to socially include some of the exclusions presented by traditional ABA, there are some very valid criticisms of the practice when individuals that are performing it are not neurodivergent informed, are not trauma informed, are not culturally competent. And I think it's super important to know that while sometimes the training of ABA is a lot more brief than like a master's degree, valid nonetheless, because it's just teaching a specific set of skills in this approach. I would say that I would love for there to be an approach of more culturally sensitive, neurodivergent sensitive, class sensitive, resource sensitive, disability sensitive ABA training so that the approach is not exclusive to anybody. And I want to explain a little bit more about what that means too. A lot of the times ABA will call for like certain techniques. Now, I'm not super familiar with it. I'm not trained in it, but I know the criticisms of it have been that the behavior being asked or the intervention being presented asks neurodivergent children to delay or subdue or restrict the natural ways that their brain works, even in some settings where the behavior they do is just different, not harmful, and it's being asked to be changed because the environment around them is not very neurodivergent friendly. And we have a traditional way of doing things in schools and expectations for children at like daycares and things like that that don't allow flexibility of how a brain works. So we've founded ABA on that in part, not in whole. I don't think this is, something that restricts its effectiveness, but that's why I think it's helpful to have those points of information and points of training outside of just the model of ABA that helps us to be more neuroaffirming. So hopefully that all made sense. Heather, do you have experience with ABA?
I do, yeah. So before I worked as a therapist here, I worked as an ABA therapist through a private family for about 5 years. And I worked with him from, I think he was like 3.5, 4, up until he was about 9 or 10. So worked with him for a long time. And my experience with that is he was pretty high functioning. However, you do start to understand like when they act out in their behaviors, a lot of it is because they can't express their needs or express what is on their mind or do things how their brain is telling them to do things. And then it becomes a thing of the parents not getting upset because they're just doing kind of like you said, what their natural brain is telling them to do. And so there's a whole component to it with you can understand why the behaviors are coming out in terms of dysregulated emotions and things like that. But yeah, no, I definitely agree with what you're saying. The training could be more extensive. And I do wonder how much too is I think there is such a huge need for ABA therapists and people who are working with autistic clients that, in a society where there's politics involved and we're thinking about the demand that's needed. I don't know if there's necessarily the population of individuals able to work or willing to work in that area. It takes a lot of patience. It takes a lot of kindness, a lot of self-regulation when you're working with this client. And so I do wonder if they just don't have the
Like the
resources.
there.
Yeah. Yeah. The resources there to do that because I feel like it's something that as a society where we feel like we're drowning in a little bit is the demand is not being able to be kept up with the need.
I think it's also an important thing to point out that there is a perception kind of going around that there is a increase in the severity or the instances of autism within our culture, at least I guess in America. We want to put that to reality as well in that our diagnostic models have gotten much more advanced and much more widespread to where we are diagnosing ADHD, autism, and all kinds of neurodivergence at higher rates because we are better at it, not because there is more. There is really no causal link between the numbers of ADHD or any other or autism or anything like that rising due to societal impacts. Again, there are studies trying to figure that out, but we don't have the hard science on that yet. So I just wanted to make a point about that too.
Yeah.
But I think that pretty much sums up the info that we wanted to get into today, and I think we all learned a bunch of good stuff. I, for one, love kind of lightly nerding out on the genetic science and the statistics and things like that. It is so affirming for me to use that lens because it helps me feel like, yes, what I personally go through with neurodivergence is real. It is science-based. I can understand it from a facts and research lens and not just kind of the emotional lens that sometimes we're forced into when we don't have that information. So
Mhm.
I think that is always cool to get into and something I will always commit to trying to sprinkle into our conversations here. And that pretty much concludes our second episode of The Art of Neurodivergence, brought to you by Neurodivergent Ohio. Just a reminder that NDO is an Ohio-based agency offering ADHD and autism counseling and assessments, and you can check us out at our website, www.neurodivergentohio.com. Have a nice day, and thanks for listening.